Chapter 23, Vital Signs and Measurements. It's important to accurately take vital signs as they may be altered by many factors, including anxiety, anger, food intake, apprehension, and mood. Vital signs are used to develop treatment plans, to obtain baseline measures, and to determine the overall well-being of the patient. It's important then to concentrate and attend to procedures. Temperature. Heat production and heat loss maintain and regulate the body temperature via the brain. Body heat is produced by actions of voluntary and involuntary muscles. Body temperature is measured in degrees and influenced by several factors. There is no normal temperature, but there is an average temperature. In adults, it is 98.6 Fahrenheit, and it varies with the time of day. Terms used to describe body temperature include afebrile, which means no fever. If a fever is present, it's febrile. Fever is pyrexia. Onset is the time the fever began. Lysis, the temperature returns to normal. Crisis is a sudden decrease in temperature. The person perspires profusely, and it's also called diaphoresis. Intermittent, rise and fall. Remittent, remains increased, never returns to baseline. Continuous and ongoing. Phase out of mercury thermometers and other mercury-containing equipment is occurring due to mercury toxicity. When the thermometers break or dispose of improperly, mercury can enter the atmosphere, and even small mercury spills should be cleaned up as soon as possible. Types of thermometers used commonly now are disposable strips, electronic digital, oral or rectal, tympanic, temporal artery. Recording a temperature, use the scale, which is F for Fahrenheit and C for Celsius, route, R for rectal, A for axillary, which is in the armpit, TYM for tympanic, and TA for temporal artery. When you clean and store thermometers, you need to separate the oral and rectal thermometers, and other thermometers are cleaned according to manufacturer directions. Pulse. Pulse rate consists of two phases of heart action. You feel that when you compress an artery. Pulse and heartbeat are usually identical in a healthy person. Pulse sites, radial and carotid. The radial is on the thumb side of the wrist. The carotid is in the neck. Temporal is in the temple area of the head. Brachial is in the upper arm. Femoral is in the inner thigh. So the upper arm brachial is on the inner upper arm. Popliteal is down by the ankle, and dorsalis pedis is at it's the top of the foot, but it's just above the big toe, in between the big toe and the second toe. Measuring and evaluating a pulse. So when you're taking a pulse, you need to note the rate, the rhythm, and the volume. The rate is the number of pulsations felt per minute, and the pulses vary. The rhythm of the pulse is the time between the pulsations and the regularity of the beat, and you need to note that in your charting. Arrhythmias are abnormal rhythms and may indicate heart disease. And then the volume of the pulse. Is it strong? Is it weak? Is it hard, soft? Is it thready? Is it full? Pulse abnormalities, bradycardia, pulse rates less than 60 beats per minute is bradycardia. Tachycardia is when the pulse rate is greater than 100 beats per minute. PVCs, or premature ventricle contractions, you feel the pulsation before you expect to, and it's not regular. Causes can be caffeine, nicotine, stress. Sinus arrhythmia, variation of rhythm sometimes occurs during respiration. Respiration is the exchange of oxygen and carbon dioxide and is an involuntary act controlled by the medulla oblongata of the brain. The respiratory rate is the number of respirations per minute and is measured by counting breaths for 30 seconds and doubling. And make sure the patient's unaware that you are counting, as that might cause them to change the way they're breathing. Respiration varies with age, activities, illness, emotions, and drugs. The average respiration rate to pulse rate is 1 to 4. The respiratory rhythm is the pattern of breathing, and the depth of respiration is the depth of the inspiration when they inhale or expiration when they exhale. This slide shows the different abnormalities in respiration. You will want to check breath sounds with a stethoscope. Presence or absence of these different sounds can indicate respiratory problems, rales, bronchi, wheezes, stridor, etc. Blood pressure measures the force of blood exerted on peripheral arteries during cardiac cycle or heartbeat. Systole is the force exerted on the arterial walls during the cardiac contraction. Diastole is the force exerted during cardiac relaxation, and it's recorded as a fraction, systole over diastole. Factors that affect blood pressure are blood volume, peripheral resistance, vessel elasticity, and the condition of the heart muscle, and uncontrolled hypertension. Equipment for measuring the blood pressure is a stethoscope and a sphygmometer for listening. And there's 3 types of sphygmomanometers. There's the mercury, aneroid, and electronic or digital. And then you can also use a pulse oximeter for a non-invasive method for measuring the amount of oxygen saturation in the blood. So measuring blood pressure, phases of sounds. Phase 1, the first sound is the systolic reading. And then as more blood passes through the vessels is in phase 2. Phase 3 is a rhythmic tapping sound as the cuff deflates. And it may be, phase 4 may be used to record diastolic pressure in children and those patients where a tapping sound is heard to 0. Phase 5 is the blood flowing freely, the sounds disappear, and when the sounds disappear, you record that as the diastolic pressure. Blood pressure abnormalities are hypertension, primary or essential. White coat hypertension is when a patient has anxiety due to being in the office and their blood pressure just goes up for that time. And then there's secondary, in which case there are underlying problems. Hypotension, the blood pressure is consistently below normal, less than 90/60. It's usually a result of shock-like conditions like blood loss or other kinds of shock. And orthostatic hypotension has to do with the position that the patient is in. For instance, if somebody gets up really fast and their blood pressure drops. Height and weight are not considered a vital sign, but It's often measured as part of a yearly physical. In health centers, you need to do height and weight at least annually for UDS measures to be compliant. Height is measured with a measuring bar, and weight is measured on a calibrated balance beam scale or digital scale. Occasionally, you might be required to convert pound weight to kilogram weight, and the significance of the weight provides insight into metabolic, nutritional, and emotional problems. Measuring chest circumference is often done on patients with emphysema and as a requirement for insurance and truck driver licenses. 2 measurements are taken, one on deepest inspiration and one on deepest expiration. And then a comparison is made to ascertain the chest capacity. Now I'm going to have Cherise show you the video. It's about 30 minutes. It's on checking vital signs, and it'll review some of the things that I've just talked about.